So our last question is kind of a hot topic. So the whole idea of aerosolized activity and if we should do it or if we shouldn't, it's been debated heavily amongst practitioners. So our last question is, are breathing techniques considered an aerosolized activity?
You're exactly right. This has been kind of a hotly debated topic. As I mentioned earlier, um, uh, earlier on, they were putting folks kind of directly onto the ventilator and avoiding some kind of non-invasive techniques because they were worried about kind of aerosolizing the virus with things like high flow nasal cannula. Um, and certainly that is a concern. Breathing is a kind of an aerosolized activity. I mean, if anybody that's ever, been outside in cool weather and breathed out, well, you see your steam, your vapor kind of leaving your lungs. So those are aerosolized particles, kind of leaving your lungs that we typically don't see. But so yes, breathing does kind of aerosolize things. How much does it is kind of the question, and how far does it go is a great question. And that's really kind of the idea behind kind of wearing masks, is that the things that are aerosolized by other patients, other people in the community or in the hospital, that it prevents you from breathing it in. But also, if you're a carrier, if the patient actually has COVID-19, them wearing a mask, it prevents them from aerosolizing. This certainly isn't breathing techniques, breathing exercises. It's not something we want patients with COVID-19 to be doing, in the hallway, out in public, but certainly in their own room with the door closed. A lot of these, patients that are positive for COVID-19 are placed in a kind of a negative pressure room. Then yeah, doing deep breathing exercises like we just discussed with incentive spirometry or deep breathing are going to be important for them to try to kind of keep their lungs healthy, to get the oxygen in. Yeah, they should be kind of doing breathing techniques. Now, if you're the therapist, you obviously want to have some kind of barrier between you and the patient as they're doing these techniques. One of my favorite techniques, other than deep breathing, which is focused more on inspiration, is what we call huffing. Some people call it the forced expiratory technique, which is it's kind of similar to a cough. Some people call it a huff cough. I don't like to call it that because I want to separate huffing and coughing as two separate activities. But it's really kind of a forced expiration without closing your glottis. So in a cough, you kind of close your glottis, you develop a lot of pressure, and then you let it loose. With huffing, you don't close your glottis. So you just kind of take a deep breath in and exhale rapidly without ever kind of closing your glottis. So the key thing there is kind of keeping your mouth open. Now we can do this kind of safely here because we're socially distanced, right? But the last thing you want somebody to do would be huffing on you. I mean, this is going to, aerosolize particles and send them out. So that's why we cough into our elbow. That's why we wear kind of a face shield with our patients when we do airway clearance. So those techniques are going to be useful to teach patients how to do. But certainly while we're protecting ourselves with personal protective equipment, and encouraging them to kind of do these activities kind of independently on their own. So, yes, we can kind of teach breathing techniques, especially things like the forced expiratory technique or huffing, like I just described, would certainly kind of be considered kind of an aerosolized activity. But we need to kind of put a barrier between kind of the patient and others to kind of minimize the spread of that. But huffing can be extremely effective in people that have secretions. So I don't teach this to anybody, but people that do have secretions that need to be cleared, huffing can be a great way of getting rid of those kind of excess secretions.